So I get a lot of medical questions on here now that we're sharing our daughter's story with LGMD. And while I'm a parent who cares a lot about this and does a lot of research, I am not a medical professional. And I think it's really important to talk to those who know the research, know the information upside down, all of things, so that it's not just coming from a parent. So I've brought in my pediatrician, Dr. Kelly, who's going to help answer some questions for us. And we just wanted to talk a little bit about some of the things that I've been seeing a lot on our comments, on our posts. So I'm going to ask her a few questions. She might ask me a few questions, and we'll go from there. So the first thing that I see a lot of is growing pains. And I know we've done some short videos on growing pains, but I'd love to talk more a little bit about leg pain, because I feel like leg pain is something that I see on a lot of parents' videos saying that it was a first sign of something that was wrong. Mm-hmm. I've seen it on some with children who have pediatric cancers. Obviously for us with LGMD, Berkeley's first sign was leg pain. Yeah. So I'd love to talk a little bit more about leg pain and how we know that it's something bigger than just a growing pain or something that might be benign.
Yeah, it's such a good question, Chrissy, because I get this all the time. And I think it's so common. You know, probably more than half of kids have what we would describe as growing pains. Mm-hmm. Although growing pains isn't a real medical term. It's a term that we as parents use for our kids when they're having leg pain. And this leg pain is going to be more common at night. It's going to be more common at the end of the day. It might even wake them up in the middle of the night. Mm. And it's really what we would just describe as benign limb pain. So it's not due to growth. It's not because their bones are growing or they're stretching or anything like that. Mm-hmm. There's probably a lot of factors, right? So genetics plays a role. Hypermobility plays a role. Probably overuse for some kids. So they do the same activities over and over. So they're always putting more pressure on certain muscles or certain joints. And some vitamin deficiencies, actually vitamin D deficiency probably plays a role in this. So it's so common. Mm. And I think the really hard part of being a parent is knowing when to worry and when not to worry.
Yeah.
Agreed. And yeah, it's overwhelming, right? And I think that social media and all the information out there has made it a lot more stressful to be a parent, because we can look anything up like that, and all of a sudden we're going down a rabbit hole that our child has cancer or maybe a muscular dystrophy. And it's stressful and it's hard.
You know, it's interesting because so Kennedy used to have what I thought was growing pains in the night, but she only had it at night. And it would be something where her calves would get really, really tight. Yeah. And she would call for me and I would come in and kind of massage her legs. But I remember as a kid having Charlie horses, having things like that. And I just assumed that she was having something similar. Mm-hmm. Looking back, obviously that may have been a sign of her muscular dystrophy. And it's hard as a parent to know when that becomes something concerning. Mm-hmm. And so because of Berkeley's leg pain, I ended up getting Kennedy diagnosed with muscular dystrophy. But had that not happened, I wonder how far it would have needed to progress before I brought attention to it. Those leg pains when she was having calf like pain at night, is that something that I should have discussed with the pediatrician, or is that something that is usually benign?
So I think it's usually benign,
yeah,
right? And hindsight is 2020, yeah, right? And we don't know what we don't know. Mm-hmm. And so I think if you brought it up to your pediatrician, there would have been a conversation and a lot of reassurance. Mm-hmm. Maybe they would have found a red flag in something you were describing, mm-hmm, right? So yeah, those Charlie horses, those are common and they happen. Mm-hmm. And so we would have talked to you about increasing fluids and drinking more water. We would have talked to you about eating some bananas and having some mm-hmm potassium in their diet. And I think when it would have been a flag to me would have been if you came in and you said, okay, we did all the things that you talked about. Mm-hmm. We've pushed the water. We've done this. Mm-hmm. We've done that. And it's still not getting better. Mm. So sometimes it's a matter of trying the kind of simple treatments first, mm-hmm, or it may be a matter of if it was persisting more than I would expect. So occasional Charlie horses, we mm-hmm might be able to chalk up to some of those things that you mentioned, but if it's every night, that might be more worrisome.
That's what I was going to ask is about frequency. Does frequency matter here? Is it like, I think with Kennedy, it was probably once every other week So it wasn't every night. It wasn't
Yeah.
all the time.
Yeah.
But it was consistent enough that I
Mhm.
noticed like, oh, this happens for her a lot.
Yeah. I think frequency definitely matters. And I would have asked all the questions about is it happening in the day? Is it limiting her activity?
Mm-hmm.
Is it gone by the morning? And from what you're describing, all of those things
Mm-hmm.
were not a red flag.
Mm-hmm.
So I don't think there was anything necessarily out of the ordinary for
Mm-hmm.
what you're describing. But I'm super curious because I
Yeah.
was not their pediatrician when they were diagnosed. And I've since become their pediatrician. And so if Kennedy was having, those muscle cramps at night,
Mm-hmm.
tell me a little bit more about when you started to see some leg pain, and when did you start to get concerned versus just feeling like, oh, maybe this is something more and not just growing pains.
Yeah, it's interesting because with Kennedy, she really didn't show leg pain as a symptom.
Mm-hmm.
Hers was more weakness, but we really went down our diagnostic path with Berkeley. And Berkeley's the one who had leg pain consistently, and it was persistent enough that I definitely had like a mama gut check of something is wrong here.
Yeah.
But it started very minor. I mean, I remember, it's funny now, I talk to some of my friends who my daughter went through preschool with their kids. And they're like, oh, I remember her having leg pain then. And it's funny because as a mom, I feel almost bad that I'm like, oh, she did? Because you write off some of those things. She's like, oh, my ankle hurts. And you're like, okay, like, walk it off. Like, those are the things that as a, especially she's my third kid. And I have been through it with my other two being like, yeah, pains happen.
Yep.
And maybe you bumped it, maybe you twisted it, maybe it was that. So I think at first it probably happened here and there. And I just really didn't pay really close attention until it started to become more consistent. And then it was my knee hurts. And after gymnastics, she started saying she couldn't walk down the stairs, which I found I'm like, you just did an hour of gymnastics. And she was she had been invited to like a more advanced class. So she was doing hard gymnastics. And so I'm like, you just worked your body pretty hard. And now you're saying you can't walk.
Mm-hmm.
Like that felt a bit like a red flag to me.
Mm-hmm.
And then it really just persisted enough. It was happening often enough. Eventually it was most of the time during the day.
Yeah.
She would say a couple of times a day, she would say, my knee hurts, my legs hurt, things like that.
Yeah.
And it was interesting. I actually did a post about this where I said, I'm really glad that I did pay attention because at the time she was saying it all the time and now she's totally stopped. And I don't think her pain has gone away because when I ask her if things hurt, she'll say yes. But I think she just got used to it. I think her life is just lived in pain and that's her normal. And so now she's just like, yeah, of course they hurt. Like that's life.
Yeah.
Which I feel terrible about, but I'm so glad that I paid attention because I think she would have stopped complaining.
And you never noticed weakness in her. It was just the pain.
It was just the pain. She still doesn't have any weakness, actually.
Yeah.
Berkeley doesn't. Kennedy does. Kennedy's starting to develop some of the weaknesses. But Berkeley really doesn't have it unless she has done something with excessive activity, which now we are kind of limiting her excessive activity. But for example, we went to the playground in the summer and she had been running around for an hour. And at the end of that, she really could not walk to the car. And it was one of those things where we had just been diagnosed and I didn't want to limit her yet. I was feeling like, I don't want to put limitations on her before the disease does, and so I just was letting her do her thing and we overdid it. And I learned my lesson that I do kind of need to put time limits on things and not let her go because she will go until she can't anymore. Right. And she's she physically cannot do it.
Yeah.
So then it was, I can't walk to the car. And I could see in her legs that they were just kind of giving out and we're done. But generally, no, she doesn't have weakness, just pain.
Yeah. Well, I mean, Chrissy, that is so much that you're carrying with you because, on the one hand, you feel like, oh, I feel guilty. Did I not pay attention? And then, I mean, if you came to the doctor for every complaint, everything, right? You would drive yourself insane. You would drive your children insane. Right. And we say in medicine, like common things are common, right? I mean, this is not common what your girls have. And so I really want to absolve you of any of that guilt because there's nothing that you could have done differently,
Yeah.
that would have changed this outcome, that would have, I think, provided a diagnosis any sooner.
And I appreciate that. I think it's interesting because we've talked, like you said, you weren't our pediatrician before at the time of diagnosis, and I'm forever grateful for our pediatrician who we did have at the time, that she actually ran the CK test. I know we've talked that not all pediatricians would have done that.
Yeah.
And the creatine kinase was what eventually led to this diagnosis. But when we first were going through that process, it wasn't something that was immediately tested. Mm-hmm. So like, when does muscle pain and the stuff that we're talking about become something where we need to get a CK test or some of the other markers? Because I remember when she did the full metabolic panel, her liver enzymes and things like that were also off, which I think, which is a sign of muscular dystrophy. But everything else was coming normal. Her blood cell counts were normal. And so the first few calls I was getting were very reassuring from the nurse saying, everything looks good. Everything looks good. And then I got a call from the doctor. And I was like, uh-oh, that's not good.
Yeah.
But when do you think a CK is necessary? And when you say that the pediatrician maybe wouldn't have, other pediatricians might not have done that, what do you think is kind of the threshold for running something like that?
Yeah, so I think that's a great question. I think that you are super lucky. I really think that your pediatrician did an amazing job of running that CK. And labs are interesting, right? It's hard to get lab work on kids. We don't do it lightly. And it's something that we take really seriously. So when I'm getting lab work on kiddos, I'm usually throwing out a kind of, I describe it as like, this is just a general net to see if there's anything that I can pinpoint. So if I don't know the diagnosis, or I'm not pretty confident of the diagnosis, I might be doing these general labs, which often general labs don't include a CK. It might include a thyroid test. It might include parathyroid, the liver that you mentioned, right? That's going to be a complete metabolic panel where you can look at liver and kidney function. So sometimes we're doing these general labs, and if something's coming up as positive, then we might dive deeper. It might help us to know which direction we're going in. You can get inflammatory markers done, which helps with autoimmune diseases or conditions that have a lot of inflammation. But inflammatory markers will be high if you got in a car accident. They'll be high if you were sick, right? So there's lots of kind of out of range, normal, transient kind of abnormal labs that go away. So I think the question about the CK is really going to come up is if it's on that doctor's radar. Right? So this is where parents advocating could be really important. If your doctor feels it's appropriate to do labs and your child's having a lot of muscle pain or muscle weakness, that's when you might just say, hey, let's just do a CK. If they're having the typical growing pains or benign pain and your doctor doesn't think labs are appropriate, I think there is something to be said for really listening to your healthcare provider. If you don't feel like you're being heard, then find someone who will listen to you. But I think that doing needless labs has downfalls, right? It's a lot of stress for families. It's incredibly stressful for kids to have blood drawn. And so I think we want to do blood work when it's appropriate. We don't want to be testing every benign thing under the sun, because I think that does harm, and we really want to do no harm. Right. So I think asking to add that CK on, if your doctor wasn't thinking of doing it, but thought that the conditions or the symptoms were significant enough, if that makes sense, to warrant blood work, asking for that CK is a really good idea.
It's interesting that you say that about blood work and how it is stressful for the kids. I mean, when we were going through this process, the girls were having their blood drawn, every few days for a little while there. And it's awful. The poor things, they do not want to be doing that. And it's not something that I would say jump to doing if you don't need to.
Yes.
It's we even had one, there was a testing error. Oh, the poor thing. Poor Kennedy had her metabolic panel and her CK done in one thing, and there was a testing issue with the lab, and unfortunately her CK did not get run, and that was the one that we were most interested in, and so we had to go back and have her blood redrawn the next day. The poor thing. So yeah, it's not fun. It's not something I would recommend for people just lightly to do, but I do think it's something that, you know, I do feel very grateful for our pediatrician who did that, that she was able to bring this to light. But they had talked a lot about myositis before we got the labs done. And that was because she had had the flu. And because she had the flu, they thought, okay, she may have some myositis or muscle inflammation due to the flu. Is that something that happens often?
It's a good question because we're not usually checking a CK in kiddos after the flu or after a cold or an infection. So to be honest, I don't know how often they would normally have an elevated CK. So when we look at labs, if there's something that really jumps out at us as being super abnormal, always part of our thought process is this a lab error? So is it a lab error, or is it a transient process that happens? So sometimes we'll see kids' platelets be super low after an illness, and we think, is there something wrong? Do they have a bleeding disorder? Is there, you know, and it's a transient normal thing that happens with the body that for the majority of us just happens, and we never know about it because we're not checking our blood work. So we always think about lab error, medical error. We always think about those things. And you had told me about kind of their levels, how the first one was 17,000.
Yeah, it was like, 17,000, something like that.
Yeah. And then the next one, when they kind of were repeating it to see if, is this a mistake? Is this abnormal? Jumped into
42,000. Yeah, it was crazy.
Yeah.
She had, and it was exactly it. When you say that, the first words we heard from the first specialist we saw was it a testing error? Because she looked good. Berkeley, like we said, she doesn't have any weakness. So for her, it was like, well, I shouldn't say she doesn't have any weakness. She does have some now for a very trained eye would see. I can't see it even at this point, and I am looking. But her neurologist can see it.
Okay.
But I can't. But at the, you know, she really doesn't have any weakness. And so the rheumatologist was like, was this a testing error? Like, there's no way she had 17,000 CK.
Right.
And then it came back at 42,000. And it definitely was a shock.
Yeah. Right. Yeah. And that is when we're kind of asking the questions, we're taking the next steps.
Right.
So I think that even with the question of, was this an error? They weren't ignoring it.
Right.
They weren't blowing it off.
Right.
It was going to be repeated. You were getting hooked up to see specialists and those kinds of things.
Yeah. Yeah. It's an interesting, I think back to the myositis stuff that we were talking about.
Yeah.
You're right. We aren't checking the labs all the time. It's not something that, you know, you want to check all the time either. We don't want to run to the pediatrician every time we have a little ache and pain, and we definitely don't want to do blood work after every little thing. But myositis, my understanding of it is that it's just muscle inflammation, and that does happen sometimes after the flu, but it sounds like it's not a common thing, but that children can have leg pain and muscle pain after the flu, even for a couple of weeks. Is that right?
Yeah, absolutely. Okay. So it's really interesting. There's probably all kinds of inflammatory conditions that we are just starting to understand. Some are autoimmune related, and some can be post-infection and things like that. That the body responds with inflammation. And the inflammation can happen in muscles, but it happens in other places too. We see inflammation in kids' brains sometime after infection, which is really scary.
Yeah.
But you know, all of these processes can happen. And I think that sometimes we chalk up abnormal things to things that are common and things that are going on.
Right.
Right. But I think when you put her whole picture together, it makes sense to kind of keep pushing and keep going down the road of exploring the possibilities. Because if you looked at any one thing, if you looked at Kennedy's calf cramps in isolation, right? If you looked at, you know, Berkeley's pain in isolation, we might be able to ignore them or fluff them off. But
Right.
I think when you put it into the bigger context, and that's what I mean about really, you know, having a pediatrician that really listened to you,
Yeah.
that really was hearing all of what was going on
Yeah.
and taking, you know, the time. And unfortunately, in our healthcare system, there's not a lot of time with doctors, right? And healthcare providers. And so really just making sure that you're being heard and listened to. And if you're not, advocate for your child and for yourself, and find somebody who, you know, can take that time and is willing to really hear you.
Well, I mean, that's why we ended up coming to you for them. So for context, Dr. Kelly had been the pediatrician for our son, who's older than Berkeley and Kennedy, because he had a medical diagnosis of his own. He's doing very well. But he had something that was a little bit more medically complicated years ago. And so we had him here. And then you do, I call it concierge medicine, but I think there's another term for it. What do you call it?
It's direct primary care. Yeah. So I had worked in kind of the regular healthcare system for a hospital and then for a private practice. And I just was feeling so burned out as a physician of not being able to spend enough time with my patients, really sacrificing myself, my own family, you know, to be able to give as much as I could. And I stumbled upon this concept of direct primary care. And so this is a model that you can describe it as concierge. It's in the concierge umbrella, but essentially it's a membership where you pay a flat fee for each child, and then you have extended visits. You have extra time with me. You can text me, you can call me, you know, and so this has been, excuse me, amazing in the fact that I get that time with people. I'm able to do those deep dives, right? And so taking care of your older son was a great example, because that's a condition that is really complicated and it takes a lot of time. And it's something that is really hard to do in our current healthcare system. So I just feel so lucky that I knew you through him, and that I can be of help and support for the girls in a very different way. You know, but it's hard. It's hard being a parent. It's hard being
it is.
You know, life is hard. Damn it.
I know. It's so funny because, you know, switching to you, I still feel guilty about leaving our other pediatrician because I adore her. And I obviously adore you. And the reason, though, is that what you talked about with the medical system is that it's just really hard. And financially, in the beginning, when we had our son coming to you, you know, it didn't make sense to bring Berkeley and Kennedy here because 3 children in direct primary care can get expensive. So it was something that we were like, oh, I don't know if we need it for all 3. And then as soon as we got this diagnosis, you know, having access to you is just, you know, invaluable. And the fact that I can talk to you anytime that there's an issue, anytime I have those concerns, if she's having consistent leg pain or something's going on. I know you've helped connect us to kidney doctors and other professionals who can help us with the various things that come up with muscular dystrophy. But I think it's a great model, definitely for medically complex children. But I think, you know, even for those patients who aren't necessarily medically complex, it's something that I have started recommending to people I know, because you never know when something's going to happen. You know, I've read memes lately that say, you know, you're just one phone call, one diagnosis away from a different life. And I feel that to my core in the fact that you just never know when you're going to need access to a medical professional. And unfortunately, our system is set up in a way that is really difficult. It's really difficult to have access to your professionals, even when you are a current patient.
Oh, 100%. There's so many barriers, right? You can't call and talk to your doctor. And it's really this model that gives me the time to be able to text a specialty colleague or email the pulmonologist and say, hey, is it time to do a sleep study on the girls? You know, what is, you know, how do I use all of my resources to really provide the best care? And so, yeah, it's hard. It's life is hard. And I think that this model is great for people who are complex, but also people who, you know, are healthy. I think having the extra time with their physician, getting to talk about nutrition and exercise and sleep. These are the things that matter. These are the things of why I went into pediatrics, right? If we can prevent disease later on, then, we're doing our job.
Yeah.
And the only way to do that is through education and time with families. And I love how well I get to know all my patients. I love being able to be a part of the team, being able to jump on a Zoom with a specialist who's out of state.
It's been so helpful.
I feel so incredibly lucky to practice medicine this way.
It's awesome. Well, talking about education, the point of these videos is for us to be able to educate anyone who's interested in learning more about muscular dystrophy, about how to advocate for yourself in the healthcare system, about growing pains, about any of these number of topics. So I very much appreciate you taking the time to chat with us and help us learn more. So thank you.
Thank you, Chrissy. It's my pleasure. And just thank you for trusting me with the care of your children and
absolutely
and going on this journey with you.
You have all of my trust.
Amazing.